threat of the monkeypox virus has raised alarms all over the world, but a COVID-19 task force official says there's no need to panic just yet.
Herbosa also said that monkeypox is not as contagious as COVID-19. He noted that some experts are also of the opinion that it will not result into a pandemic.
Nakita niyo naman, ang pagsara ng borders, malaki ang epekto sa turismo, ekonomiya, at saka supply chain ng ating mga goods and services. So hindi sapat o hindi tama na dapat mag-close down dahil parang sinabi mo lang may outbreak ng bulutong tubig sa ibang parte ng mundo. Magbabantay rin tayo, maghahanda tayo ng preparedness. Basta importante ay aware tayo about sanitation and cleanliness, hygiene, mas less ang chance makakuha ng infectious disease. At yung paghawak ng mga hayop, kasi nga ito ay zoonotic diseases.
Despite more than 100 cases of infection by the monkeypox virus that have been reported around the world, health experts maintain that the infection can be easily contained and that the risk is low. But is the new and emerging disease an added threat to COVID-19? We discuss in this episode of The Chiefs. We will be joined by our guests and the other chiefs when we return. Welcome to this Tuesday edition of The Chiefs. I'm Ed Lingao. Also with us, Ana Marie Pamintuan of the Philippine Star and Lucy Cruz Valdez, the head of News 5. Ladies, happy Tuesday.
Happy Tuesday.
Hello, happy Tuesday. Maligayang Martes.
Oh, Martes. What's our big story tonight going to tomorrow? Ami, what's your headline?
Smooth na smooth yung canvassing, ano? At baka daw by tomorrow afternoon tuloy na yung mga proclamation.
And
Wala na lang magpo-protesta walang magpo-protesta.
And nag-wave ng presence sa
Nag-concede na rin siya, no? Yeah,
Well, they will not block the
question.
canvas.
So long as they say,
mabilis.
so long as it's a legitimate COC,
Yes.
without any questions, they will not block it. So
Hmm.
yun, mukhang by tomorrow we will have a proclamation at the very latest. Okay, but maliban doon, we're also looking at several concerning stories about
Oo nga.
COVID-19 and monkeypox.
Yes. Both COVID and monkeypox.
Yeah, so
Alam mo,
mukhang
Mga kamag-anak ko nagkakalat
Ganoon. Oh,
Mga
mukhang
unggoy. Kamag-anak ko nga.
mild naman. Mukhang mild naman so far.
which one? COVID or monkeypox?
Yung COVID,
Okay, okay. Kasi,
mild uptick.
Okay.
Mild
Yung
uptick by
monkeypox,
June.
wala pa rito eh.
Yeah. Okay, let's bring in our first guest for tonight. I think we're kind of fully packed tonight. We have 3 guests. Let's bring in our first guest. Now joining us is Dr. Alethea De Guzman, the OIC of the Epidemiology Bureau of the Department of Health. Magandang gabi, Dr. De Guzman, and thank you for joining us tonight.
Good evening, Doc.
Good evening, Doc.
Magandang gabi po and to everyone who's listening and watching. Good evening.
Good evening po. Ma'am, well, I suppose I should say na it's a good thing it's not smallpox until
Yes.
until I saw the images of monkeypox and its effects on
Yeah.
people. So, syempre, di ba, impact kagad ng visual ng images give us a rundown. Exactly what is it and how troublesome could it be?
Tama na narinig ko kanina yung short na clip with Ted Herbosa and una gusto nating mapaabot na it is a zoonotic disease, meaning posibleng magkaroon ng transmission mula sa hayop papunta sa mga tao and then actually human to human transmission. Ikalawa, paano ba nahahawa ang isang tao ng monkeypox? So it's primarily number 1 through droplet, parang katulad nga po ng COVID. At ikalawa, yung direct contact po talaga, So, kung meron kang ulcer or rash, tapos dumikit, sa balat ng isa pang tao, posibleng doon po magkaroon ng transmission. Pero gaano ba siya kalala, Ang monkeypox ay unang nagrepresenta na parang flu-like symptoms lang na may lagnat, masakit ang katawan, mabigat ang ating katawan. Tapos in several days, doon po lalabas yung tinatawag nating vesiculopapular lesions. Parang kamukha po talaga nga siya ng chickenpox. Kasi may tubig, tapos yun po yung rash. Pero siguro yung medyo kakaiba, ang term po sa doktor ay pathognomonic or unique kay monkeypox ay yung pagkakaroon ng pamamaga na makulani, tinatawag nating lymphadenopathy. So, yun po yung nakikita natin sa ating mga kaso ng monkeypox. Hindi po madalas na may mga severe manifestation or complication ang monkeypox, pero meron din tayo mga nare-report na deaths. In this recent report of cases coming from Europe, US, and even Canada, while most, all of them had mild presentations, but we have not seen any reported death po. So, magkakamukha po sila, magkakapareho din, paano po nahahawa. And much like COVID, the precautions is really universal precautions of hygiene. The masking will help because it's a droplet infection, and physical distancing because it can be transmitted via direct contact.
Ma'am, when you
Akala ko ba, sex between men?
Ayun,
Saan-
magandang...
may ganong finding yung WHO, at least that's what I read, Ano ba
Yeah.
talaga? So, droplets ba or sexual contact?
So, magandang paliwanag yan, Ma'am Lucy. So, nitong Mayo, nireport nga ito ng WHO dahil ang term nila, it's atypical, Ang mga bagong nare-report na makaso galing sa tinatawag nating non-endemic countries, meaning mga bansa to na usually wala namang kaso ng monkeypox ay nakita o na-report among the men having sex with men. Pero yung tanong na, sigurado na ba talaga tayo na sexual contact yung naging dahilan kaya nagkaroon ng transmission among these, tawag natin MSM, yan ho ngayon ay diskusyon, pinag-aaralan ngayon, the WHO, the World Health Assembly is ongoing. It's possible din po kasi na direct contact nga, It's just that the cases that are being reported are coincidentally men having sex with men po. So, kapag tayo ay nakakuha ng updated na findings or report from this discussions in WHO, we'll be sure to update our media and our public po.
And you're talking about MSM cases in non-endemic countries.
Yes, it's in non-endemic countries po,
Pero
no?
dun sa mga endemic, paano kumakalat? Saan ang gagaling? Kung zoonotic, is it monkey? Yun ba yung pinanggalingan? Or, gano'n ba yun? Tapos paano na-transmit to humans?
Sa ngayon po, dahil endemic, meaning kumakalat or parang talagang present na siya doon sa bansang yon, the main form of transmission is either droplet from human to human or direct contact from human to human.
Okay.
It's not from, pero tama po kayo, the zoonotic portion is coming from pag tayo ay nag-handle ng mga infected animals, for example, sa wild, posibleng magkaroon po ng transmission kapag ganoon po.
Pero Dr. Hindi naman siya kasi intindi ng COVID, Kasi ang COVID kahit magkasama lang kayo in a room masama ang ventilation, pwede kang mahawak. Ito, kailangan magdikit kayo, di ba? Kailangan may physical contact.
Pero droplets
Yung droplets nga yun tatamaan ka, merong actual contact, di ba? Hindi ka pareho ng na sabi nila airborne Kaya nga dito sinabi, ayusin yung ventilation sa mga offices. Kaya gusto natin, al fresco tayo. So, hindi naman siya ganun katindi. Hindi siya katindi ng COVID.
Masasabi natin, Ma'am Ami, na in terms of transmission, mas nakakahawa nga po talaga ang COVID. Una, hindi lang sa kailangan dito kasi kailangan magkalapit talaga kayo. Kung hindi magkadikit ang balat, dahil droplet, magkalapit talaga kayo, less than 1 meter distance. Pero pag airborne nga po kasi, posibleng magkalayo tayo, pero dahil nasususpend sa air yung COVID, yung SARS-CoV-2, mas magkakahawaan po tayo. So, less transmissible, and as such, mas mabilis ang pagkalat pa rin ng COVID kumpara dito sa makikita natin sa monkeypox po.
So, ano yung earliest signs? Kasi, tingin ko, it's a matter of time lang bago dumating na naman yan dito kasi
Wag naman.
12 countries na non-endemic and there are people there who travel and they enter the Philippines freely. So anong babantayan namin symptom kung sakasakali? The earliest symptoms.
Sa ngayon, tama kayo, ma'am, ang sinasabi ng WHO, hindi nga talaga malayo mangyari na kumalat pa siya sa ibang bansa. So ang Pilipinas, naghahanda siya by number 1, really strengthening yung screening muna talaga sa borders natin. Ano yung binabantayan natin? Tulad ng nabanggit ko, ang mga unang senyales ay para kang nagtatrangkaso. May paglalagnat, sakit ng ulo, mabigat ang katawan, nawawala ng gana, Pero yung typical na presentation niya ay kapag sinundan po ito ng rashes, yung vesiculopapular rashes. Ngayon, paano yun? Panahon pa naman ngayon. It's summer. Madaming pwedeng nagkaka-chickenpox. Yung tinatawag din nating hand, foot, and mouth disease. Medyo magkamukha po ito, So, paano masasabi na hindi monkeypox, Tulad ng nabanggit po, ang unique na presentation din ng monkeypox ay kung may pamamaga ng ating mga kulani or lymphadenopathy. So, kung nakikita mo, medyo kakaiba yung presentation, tapos may pamamaga ng kulani, napakahalaga na magpatingin po agad, just to be sure na ito ba is the usual chickenpox or HFMD or it's something different, And yun po yung dapat natin bantayan sa ngayon po.
Ma'am, can I back up a bit?
Treatment dyan? So kung meron ka anong treatment? Meron
Parang
ba?
any viral disease po siya, there is no treatment, Supportive treatment lang. So pag naglagnat, magbibigay tayo ng antipyretics. Kung masakit ang lesion, we give, pantanggal ng sakit, There are some antivirals being recommended, but right now, it's not yet available in the Philippines. Or some are available via compassionate special permit, So, ang mahalaga is makapagpatingin, ma-verify natin, is it monkeypox or something else? And 3, parang COVID, you isolate and you identify your close contacts so that you limit transmission.
Pero fatal ba?
Mayroon po tayo
Is
mga
it fatal?
nare-report na mga kaso po. So far, itong mga pinakabagong nare-report na monkeypox sa non-endemic countries, wala pa pong death no, na reported. But of course, in the endemic countries, meron po tayong mga nare-report na fatalities po. Early consultation, management will really be key no, in preventing severe disease and any fatality from monkeypox.
Doc, can I back up a bit lang? Kasi you mentioned
Sure.
two modes of transmission. One is droplets, the other one is contact. I'm wondering lang if this is in any way respiratory. In other words, when you inhale the droplet and then you get the infection. Kasi you also mentioned contact. So by that, do you also mean that skin to skin is enough
Yes.
to cause transmission, or does it have to be through broken skin, for example, like other viruses, like I think Ebola, you have to get fluids through your skin for you to get infected. So paano yun? Is it a simple contact, or does it have to be fluids into your body?
Yeah. Tama po kayo, sir. No? So, hindi naman siya parang magkadikit lang tayo, makakawaan na kita. No? It works na there might be small, no? Parang baka pwede may mga non-visible cuts sa skin natin.
Abrasions.
Yes po. So, usually, kung dahil vesiculopapular nga siya, yung fluid, no? Or yung part ng lesion, pag yun ay tumama sa skin natin, yun yung posible maging dahilan na magkaroon po ng transmission. So very important, no, especially healthcare workers, if we're going to be handling similar cases, is really the use of protective equipment. And tama po kayo, the droplet, no, kaya may mahalaga pa rin parang COVID, the use of mask, no, to prevent the transmission from one person to another.
Because you mean you can also
So
inhale it? Ganun ba? You can also inhale it like COVID-19?
Yes po, no, yung face-to-face exposure, but that's mostly not among healthcare workers, no, kasi very close, no, pag-aalaga tayo, it's direct contact with our healthcare workers. So the face-to-face exposure, the droplet is most commonly identified, no, or observed among healthcare workers taking care of these cases of monkeypox. Pero kung non-healthcare worker, it's really by direct skin contact po yung transmission po natin.
So kung self-limiting, Doc, gaano katagal yan bago gumaling yung patient?
Sinasabi po natin nila, it can take 21 days. No? Kasi para masabi natin na hindi na tayo infectious ay dapat tuyo na yung scab, no, or yung lesion natin. At parang chickenpox po talaga, no, habang may tubig pa, posibleng nakakahawa ka. It's during this prodromal phase, yung parang naglalagnat, tinatrangkaso ka, hanggang sa gumaling, no, yung mga lesions natin. Yun yung mga infectious phase po ng monkeypox.
Okay, Dr. Alethea de Guzman, the OIC of the Epidemiology Bureau of the Department of Health. Doc, maraming salamat for joining us tonight.
Thank you, Doc.
Thank you. Have a good evening.
Although
You too.
not very comforting words. Thank you, Doc. Okay, moving on to another disease. A more familiar disease this
Disease
time.
night.
Okay. Now
Balik
joining
sa
us
dati.
is Dr. Leilani Gustilo, an infectious disease specialist. Dr. Gustilo is also the head of the Infection and Control Committee of the Dr. Paulino J. Garcia Memorial Research and Medical Center in Cabanatuan City, Nueva Ecija, which is a member of the Private Hospitals Association of the Philippines. Doc, magandang gabi po and thank you for joining us tonight.
Hi,
Good evening, Doc.
Yes, Doc. Good evening, Doc. Doc, we understand yung PHAP, yung Private Hospitals Association, has recorded 5 to 10% increase in admissions of COVID-19 patients in the last 2 to 3 days. How concerning is this? Should we be worried by that number?
Actually, the increase in the number of admissions of COVID-19 could be secondarily doon sa mga increase in cases that we see in different areas lang, no, in segregated areas. But as a whole, for the whole Philippines, hindi naman ganun kataas yung cases. Actually, mababa pa din yung cases if we're going to talk for the whole Philippines.
So how are you treating the COVID patients? I mean, compared to how it is in a usual surge, do you still segregate COVID patients, and how many beds do you assign to these segregated areas?
Yes.
Especially compared to the surge. Yeah.
Yes, we still have the COVID-specific beds. We still have beds for them. We maintain our 30% bed capacity for our hospital.
And is that standard for all hospitals? So 30% for all hospitals.
Yes, I think that DOH actually has
Mandated
given us
it.
the recommendation to maintain
Ah.
the bed capacity for COVID patients.
Anong
And
klase?
how is it? Napupuno ba? Doc, sorry. Napupuno ba?
No,
Yung 30%?
no.
Okay.
Actually, in our hospital, we do not have a COVID patient admitted at the moment.
Right now.
Pero
Yes.
yung mga areas na na-report, kasi six regions daw, medyo umakyat na yung cases in the past few days. Anong klase yung mga infections? Critical ba siya or mostly mild or anong klase yung infections nila?
Actually, if we're going to look at the numbers, there is actually a decrease in the number of COVID ICU beds being used in the hospitals.
So, ibig sabihin,
Ano
wala na
yun?
nagsiserious. Oo.
Mild and moderate yun? Or, kasi asymptomatic, hindi naman nagpapa-hospital yung mga yan.
Yeah.
Mostly moderate cases.
Oh, sa meron
And how long? Oo.
yes.
How long do they usually stay confined pag moderate?
Pag moderate, it depends. It still depends on the course of the patient. But usually, we see the patients 7 days is matagal na yun.
7.
Oh.
So,
Tapos
because
ano?
we do not
Yeah.
need the isolation in the hospitals.
Mm-mm. And Doc, do you give the new medicines now? Yung mga, ano nga ang pangalan nun? Nakakalimutan ko na. But there are new
Molnupiravir
medicines now.
and,
Are they
the
being
Molnupiravir.
administered? Yan, yung mga, yes. Is
Yes,
that
it's available.
SOP already? Yeah.
Yes, it's available in the hospitals, and we have criteria for which we can give the new drugs.
But Doc, are you
Ano
noticing
yung karamihang new
anything?
cases? Ano sila? Unvaccinated or fully boosted? Mga breakthrough cases ba? Karamihan?
Yes. Most of the cases being admitted are the unvaccinated. So I'd really want to take this opportunity to tell the public to please, if you have the chance, go and get vaccinated because the vaccines really works. And it even works even for the Omicron cases. These vaccines really work.
So talagang kahit primary dose, wala sila. That kind of vaccinated. Unvaccinated.
Yes, though we have a 76% vaccination rate in the country, ang nakakalungkot po doon, mababa pa rin yung vaccination rate for the boosters. So please, for the fellow Filipinos, please get the vaccines.
And the booster.
And the booster, yes, if you have the chance, get the booster. Right now, we even have the second booster shot for our immunocompromised, the senior citizens, and the healthcare workers.
Doc, I'm wondering if you're receiving any reports of any new patterns or any new symptoms or anything out of the ordinary as far as your patients are concerned, patients with COVID-19. May nagbabago ba dun sa disease at sa presentation
Yes, for
niya?
COVID-19, mas mild nga ngayon kasi actually with Omicron, we see even mild cases. Yun nga lang mas mataas ang transmission rate for Omicron. But compared to Delta, mas mild ang symptoms of Omicron.
But that's as far as it goes.
Nadi-distinguish nyo ba yung, sorry Ed.
Yeah, it's okay.
Okay. Yeah. Now, are you able to distinguish pa between the variants? I just wonder, meron pa ba kayong nadidetect na mga, say, Delta or the other variants that came before? Or do they all present themselves as Omicron?
Actually, we'll be able to know the variants when they get the
Genome.
genotyping, yes. But as
Not based on symptoms, no.
as it is based on the experience that we had, the Delta virus will really present as more severe presentations, and Omicrons are the ones which are milder.
Okay, so meron pa rin yung severe. So they're
Yes.
possibly,
Especially for the unvaccinated.
yes.
What
Okay.
about the pediatric cases? Marami pa rin bang mga bata? Kasi nag-umpisa na rin yung vaccination nila. Pero yung mga younger, yung mga children, kumusta yung mga cases?
Right now, we don't have, I don't have the data, but I think cases now varies, and they are most for the unvaccinated. Mga bata, I really don't have the data, but we see that they are the ones who are being admitted are those who are unvaccinated, both adults and children.
Kasi sa school opening, mag-full face-to-face na yata tayo nationwide. That's why I'm curious kung ano yung impact netong marami nang nag-roll out ng face-to-face, di ba? Kahit limited.
Yes, ma'am. Especially now, we only have the vaccines available for our 5. The youngest would be the 5 to 11 age group. We still do not have the less than 5 vaccination, But hopefully, we'll be able to get to that. Because in other countries, they are already giving the less than 5 vaccines.
Okay. Dr. Leilani Gustillo of the Dr. Paulino J. Garcia Memorial Medical Research Center in Cabanatuan City. Ma'am, thank you for joining us tonight. At ingat po parate.
Thank you.
Thank you, Doc.
Thank you.
We will just go into a break, so please stay with us. Welcome back to the Chiefs on One News, and now joining us is Professor Guido David, Research Fellow of the Octa Research Group. Prof. David, thank you for joining us, and welcome back to the Chiefs.
Hi, good
Welcome
evening.
back, Prof.
Welcome. Yeah, hi. Good evening again, Ami, Lucy, and Ed.
Prof, whenever we have you, we're always trying to fish for good news. Pero now, when you talk about a mild surge by June, hindi ko malaman kung good news ba yun o bad news. So exactly what are we looking at, and how should we look at it?
Well, I would say it's not bad news. Kasi although we might have a surge, and andyan na yung early signs the reproduction number has crossed 1. So for the longest time, the reproduction number was hovering around 0.2, ganun kababa. So basta less than 1 yung reproduction number. it's good news. This is sa NCR. Ngayon, over the past 3 days, it has crossed 1. So tumataas siya, lumagpas na siya sa 1. It's at 1.05. Ngayon, the last time it crossed 1 na pataas, kasi pag pababa, okay lang yun.
Yeah.
Na nung natapos na yung surge natin, it crossed 1 pero pababa na siya. Pero the last time it crossed 1 na pataas was December 24, just prior to the Omicron surge. And the last time before that was July 24. So I checked the dates. So July 24, just before the Delta surge, yung Delta surge na medyo contentious noon, yeah, because we were, saying there was going to be a surge. So there's that telltale sign. Now, yung on the positive side, yung pag-cross niya ng 1, medyo mabagal. So unlike nung Omicron talaga, it got us, it was below 1 and then suddenly it was jumping. Tumatalon kasi nakita naman natin sobrang dami ng cases nung late December and then nung January. Talagang it was explosive. So this is not going to be explosive if it, pwede naman hindi siya magtuloy-tuloy. But I'm just saying na based on history, na every time it was crossing 1, ito na yung simula ng surge. But the rate it's going, it looks like it's medyo slow. Kumbaga sa Baguio, parang hindi siya ganun kalakas na hindi siya yung storm signal number 3, baka parang signal number 1 lang siya. And it looks like, the number of cases will be relatively smaller. Sabi ko nga, it's going to be like a weak surge.
Sir,
Pero
just
talaga bang surge siya? Kasi pag sinabi mong surge, medyo marami-rami yung cases na pinag-uusapan Would it be more accurate kung sabihin spike lang?
Well, we can't say that yet, Ami. So that's why yung sinabi ko is the worst case is a weak surge. I didn't say na projection natin. The best case is walang surge. It's just parang uptick lang siya. In terms of level siguro we could say uptick yung pinakamahina and then maybe a spike in cases or an increase in cases and then small or a weak surge and then a full-blown surge. So right now, yung worst case, and this is based on what we're seeing in South Africa, for example, kung saan nagkaroon ng surge due to the Omicron BA.4. I'll give you an example. Sa South Africa, they were at 1,000 cases per day and then they hit mga 10 to 15,000 cases. So mga times 10. So tayo, we're at around 200 cases per day. It's possible we might hit mga 2,000-3,000 cases per day, which is not bad actually. We can really manage 2,000 to 3,000 cases per day sa whole Philippines.
Kasi yung 1% mong it's in Metro Manila, di ba? Although yung DOH sabi nila, they noted a slight uptick in 6 regions sa COVID. Sa inyo, saan bang regions nakikita nyong nag-uumpisa na rin umakyat? Apart from Metro Manila.
Right. Kasi, Ami, sa Metro Manila, pinaka-magandang testing natin. We're still averaging around 11,000 tests per day sa Metro Manila. Not a lot, pero hindi rin naman ganun kakonti. Some regions like Agusan del Norte, we're seeing small upticks. Meron din sa, South Cotabato, consistently medyo, some cases there. They're still at low risk. You can have an uptick, tumaas yung cases mo from 2 to 4, malaki tinaas niya. But, 4 cases per day is still low. Pero, syempre, we're looking at the projections. We're looking into the future. Ano ba yung magiging possible scenario? So, itong 4 cases na to, pag naging 8, pag naging 15, 20, then it starts to become a bit concerning. So, is it headed there? We can't say yet. So, sabi nga ni Ami, it could be just a spike. Pero pwede siya magtuloy-tuloy based on the experience of South Africa. Medyo nagtuloy-tuloy siya. But we're hoping that our wall of immunity will still hold. Kumbaga, meron tayong brick wall of immunity na solid siya over the past several months. Pero unti-unti siyang medyo humihina na yung wall natin and it's easier to penetrate through the wall. Ito yung mga breakthrough cases. So may mga konti-konting nakalusot. Maybe it's happening. Pero pag medyo nagiba na yung part ng wall, then we'll start to see the surge.
You mentioned testing. I'm wondering if the actual number could be higher simply because this is probably Omicron and people are just testing at home, and many of them are probably not even testing, and they're just resting their COVID, if indeed it is COVID, and a
Definitely,
few,
right.
and they'll get over it. So how possible is it that the numbers are even bigger, except that people are not being tested as much as, in the numbers that they were before?
Right. Well, Lucy, definitely we're usually not testing as much as we should, so the number will probably be higher. But in fairness, I'm not expecting that there's actually 1,000 cases now na hindi pa natin. Well, 1,000 cases is possible, but like 10,000 cases it's probably not happening yet right now, because we're looking at other indicators. But some other indicators are starting to go up. So yung hospital utilization, it went up slightly. And anecdotally, I'm hearing from doctors, yung mga friends namin sa Octa na doctors na they're saying na they're starting to see a few more patients now compared to before. So again, parang sa kanila rin, naramdam nila yung parang uptick na tumami yung pasyente ko, nadagdagan ng 2, nadagdagan ng 3. Not yet at the level na, nagdadagsaan sila. So we know na hindi pa naman massive yung surge, but at the same time, they're definitely feeling this uptick.
Yes, sir. But sir, with small numbers nga kasi, like you said a while ago, with small numbers, a slight increase is already sounds massive. Dagdag ng 3, that's already like
By
300%
percentages,
increase,
so,
di ba?
yeah.
So that may skew the numbers then in that sense.
Well, yes, that's true. That's why we're being very careful in checking these small increases. In fact, yung upticks, they've been happening over the past several weeks and even months. Now we're seeing some upticks, tapos nawawala, upticks, nawawala. So, people were saying back then, magkaka-surge na. Tapos we were not really saying na, may surge na nangyayari. We're just saying may upticks. Ngayon, I think the difference is that there's a more consistent increase across the board sa mga indicators. So, tumaas yung cases, tumaas ng konti yung positivity rate, tumaas ng konti yung hospital utilization, yung consistency, even sa Google Trends, which I'm using, yung search for paracetamol, tumaas na rin. So that's actually one indicator.
Pati yun,
yeah, pati yung Google Trends medyo tumaas. Dito, I tend to use the Google Trends.
Well, it's also flu season.
Yes.
I mean, it's because of the rainy season, di ba? Yeah.
Right, it is flu season. In fact, I had flu symptoms recently. Nagpa-test ako, nag-negative naman. But I was feeling a bit under the weather. Pero ayun, I mean, so maybe, yeah, connected din yung paracetamol. But yeah, we're seeing still some slight increase sa positivity rate sa hospital utilization. And from the doctors we know, sinasabi nga nila, a few more COVID patients. Not yet at an alarming rate, pero we also know na yung BA.4 was already detected here. It's a variant of concern. It caused a surge in South Africa. It caused a surge in the US. So if we put 2 and 2 together, it's likely to cause a surge here. Not necessarily, maybe maswerte tayo, maybe it won't cause a surge here, but going by history, I think it's more likely that it will cause a surge, pero hindi gano'n ka massive na surge.
Actually, nag-warning nga yung di ba, yung health experts na after the elections, posible nga daw magka-surge by the end of May or early June. Tama ba yung, I think you also issued a warning similar to that, no? At medyo pareho din yung timing ninyo. Consistent ba yan dun sa mga, you're tracking the trends, di ba? Consistent ba siya sa nangyayari ngayon?
Well, yeah, it's medyo consistent. But yeah, of course, hindi naman ito election-related yung uptick.
Hindi talaga. Yeah.
We don't think it's election, right?
Yeah.
Right. I think it's more connected to the new sub-variants, yung BA.2.12.1, yung BA.4, and also yung waning immunity, because most of our immunity came from January during the Omicron surge. So ngayon, the immunity is starting to wane. So kaya yung sinabi ko kanina yung wall of immunity, humihina na siya because of the waning immunity. Pero nung February, malakas pa yung wall natin. So hindi maka-penetrate yung mga, yung mga breakthrough cases.
Yes, sir. But sir, with that in mind, have you factored the waning immunity in your calculations, in your projections? Kasi December, January, karamihan sa nagpa-booster, hindi pa nagpapa-booster since then eh. So we're going to the 7th month already, almost. By that time, I suppose, mababa na talaga yung immunity. Sa mga nagpa-booster, mas marami pang hindi nagpa-booster. So have you factored all these in your projections?
Well, we have factored them in. Medyo mahirap, Ed, because hindi pare-parehong response ng individual people. Some people, yung antibody levels nila stay high for a longer period of time. Some people, mabilis bumagsak yung antibody levels nila. And but that's why internationally, they definitely encourage yung second booster shots. Sa akin nga, why not? I mean, kung wala nagpapa-boosters, why not give it to people who want it? I mean, we have stockpiles of vaccines that are about to expire. I mean, what are we waiting for? I mean, we're waiting for the new sub-variant. Diba? I mean, a lot of people parang naka-move on na sa COVID, but there are still some people who are, concerned. They're concerned about long COVID, yung long-term effects. They don't want to get infected or reinfected. And they will gladly take the booster shots, second booster shot. So yeah, it's just a matter of, we have the stockpile, why don't we use it?
Well, naka-move on nga sa COVID, ito naman yung monkeypox. Kung sakasakaling pumasok dito, will you also be tracking infections? Kung sakasakali?
Yeah, definitely. I mean, it's a learning process. I mean, kahit naman yung COVID, it was a learning process ng 2020. Siyempre, by now, medyo alam na natin yung COVID. We're medyo familiar with it. We're familiar with Omicron. Monkeypox is something new. Well, at least to me, I've never heard of it. I've been reading about it, and sabi nga ng mga doctors na kilala namin, sina Benjico, for example, na it's been around for a while, pero hindi siya gano'n ka-infectious eh. But what is what is uncharacteristic is that it's found in many countries already, even though hindi siya gano'n ka-infectious. Of course, ang explanation nila is because of the travel, gano'n. In fact, there's some issues raised about yung mode of transmission niya eh, na a lot of transmission was male-to-male transmission. So from what I heard.
So magta-tracking kayo ha? Kung sakasakaling pumasok.
Yeah, but I don't think it will be necessary. I mean, I hope not. Now we will have large numbers of cases or there will be a major outbreak of monkeypox. I hope not. But if there's the data, definitely, it should track namin. Pero based on its history, it's not going to spread quickly. Kumbaga, yung reproduction number ng monkeypox should be fairly low. But if it's not the case, if it's actually a higher reproductive number, that would be surprising, and it would actually be a cause for concern kasi this is a public health issue, itong monkeypox.
Prof, paki-qualify mo nga yung weak surge. Is it weak because it's slow? The rise is slow compared to previous surges, or is it weak because I don't know what could be the other basis for calling it a weak surge?
Yeah, I was trying to. Yeah, I was trying to characterize it as something more than a spike in cases, but almost like a surge, but relatively lower numbers. So tama yung sinabi mo, weak in the sense that the numbers should be not as high, but I think you were alluding to maybe I was hinting at the possibility or yung characterization as weak because relatively minor yung mga cases, not a lot of hospitals. That would also be true actually because it's still an Omicron subvariant. But I was mainly looking at yung numbers. I think if we hit mga 2 or 3,000 cases per day, that would be called weak for me because that's not a lot. 2,000 cases per day nationally, it's not going to be a threat. Yeah, there will be some disruption, economic disruption, minor, but nothing major, and we don't have no lockdowns needed for this.
Yes, will not require lockdowns.
Right.
Or ano yan, parang raising lang ng alert level, ganyan lang ba yan? By
Possibly.
probably a notch? Mga
Right,
ganyan
possibly
lang.
at worst, yes, depending on the hospital care utilization.
Oo.
Baka maging alert level 2, or maybe hindi man nga, if we're just at 2,000 cases per day, we might not even go to alert level 2. But it depends. These are just preliminary projections. It could be worse than my projection, or it could be better. Baka nga walang mangyari. We're saying baka walang pagtaas ng cases, and people say, oh, wala naman nangyari. Or it could be a bit worse. We could reach 5 to 10,000 cases, then it will be a bit more serious. Not as serious as the previous Omicron surge na we had 40,000 cases, but 10,000 cases, hindi naman siya, petics lang kumbaga.
So, sir,
In
remember,
Metro Manila, ano yung worst case scenario mo? Kasi with waning efficacy ng vaccines and people not wanting to get boosters, baka magkaroon pa rin tayong problema, di ba?
Yeah, in Metro
Worst case.
right. Metro Manila, we could reach mga 1,000 cases per day, something like that. Not really a big concern, but but it's something to be a bit concerned about.
sir, remember
And granular lockdowns, ano?
There might be some granular lockdowns, definitely, Ami. But I think not something na, na people will be panicking or something. I mean, or maubusan ng testing like nangyari noong January, punan yung mga testing centers.
Yeah. So remember when
Or
we
pati
were
health
having these
workers,
discussions
nadadam.
about
Yes.
when we were having these discussions about COVID finally becoming endemic, I'm wondering how to factor that in now that we might have a weak surge. Is this any indication that we're on the way to having this become an endemic issue, meaning that it becomes part of our normal lives?
Yeah, actually, Ed, that's a good point. Na if we see some surges like this, a weak surge and getting weaker, at some point we will no longer be concerned at all with these weak surges. Na parang wala lang yan, parang it's COVID season,
live with
parang
it.
may
Parang flu season.
flu season, right? But of course, it adjustment period, adjusting to this and or living with this, it will take some time pa rin. We don't need to rush this. I mean, some countries are employing this basically. I heard Spain and many South American countries, they're considering COVID endemic, so they want to live with it. So inalis na nila lahat ng restrictions, no more testing, etc. So they're treating it like flu. Tayo, we're taking it a bit more carefully. But I think we might get to that point eventually. Kung makita natin na, ganyan lang pala yung mga surges, mga maliliit lang, konti lang, puro mild lang, can be treated with paracetamol, home treatment lang. But the reason we're taking it carefully, for me, is because hindi pa siya endemic all over the world. In Taiwan, they're having a massive surge. I mean, they have 100,000 cases per day. And this is Taiwan.
Reason doon. Kasi yung laging tanong bakit nagsasurge pa sa ibang lugar? In places where wala naman noon, no? Or they thought tapos na. Anong nangyari doon?
Well, in countries, Lucy, in countries like Taiwan and China, na very good pandemic management in the past, kasama na rin dito yung mga Vietnam. Nung nakalusot na yung Omicron sa kanila, wala na, parang, I mean, their wall was really an artificial wall, yung zero COVID policy. So they're preventing COVID from coming in through, prevention. Pero nung nakalusot na, their vaccines were not sufficient kasi they also need natural immunity. Tayo, malakas ng natural immunity natin. That's why we have this wall of immunity. Sa kanila, mahina pa. So, nung nakapasok na yung Omicron, yun, marami, in fact, especially mga seniors, vaccinated and unvaccinated. And ayun. But since nakalusot na dito sa mga countries na to, we're gonna have less and less of these countries na yung mga hindi pa napasukan, tapos finally napasukan, and then nagkakaroon ng surge. So, you can say na China's almost done with it, and Taiwan siguro, and we might have less incidents of this, and that will help us move towards endemicity.
So, Doc, parang sasabi mo, masanay tayo sa mikrobyo.
Yes, parang ganun. Pag, di ba, yung mga batang kali, pag naglalaro sa kali na parang hindi na sila nagkakasakit kasi matibay na yung katawan nila, matibay na yung resistensya nila.
Okay.
So, may kabutihan din palang idinulot yung late na pagpasok ng mga bakuna, no? Kasi kahit pa paano,
Actually,
karoon ng natural immunity.
actually, meron nga in a way, Lucy, and as my colleague would say, si Father Nicanor, it was, I'm not saying it, he said it, it was like a blessing in disguise, but I don't want to say it that way, but he said it, so ayun.
Okay, that's a good way of looking at it.
All right. Thank you.
Okay. Professor Guido David of Octa Research. Sir, maraming salamat for joining us tonight. Bigla may good news ka.
Thank
bigla,
you,
ano?
Prof.
Well, not such bad news. Thank you again. Good evening.
Ingat, sir.
Salamat.
Salamat po.
Amy and Lucy.
And that'll be all for this Tuesday edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, watch and stay safe, Philippines. I'm Ed Lingao.
I'm Mami Pamintuan of the Philippine Star.
And I'm Lucy Cruz Valdez from News 5, and we are One News.